Hi everyone, and thanks so much for joining me today on drsue.ca. Today we're going to talk about how to prepare for a COVID-19 infection if you're a person with diabetes. So I made a list of 5 things that I think are the most important things to do to prepare. The first one is lists. You want to have lists of the doctors and specialists that are involved in your care ready to go in case you need to get help because of a severe infection. You want to have a list of your medications available as well, ready to go. What medications are you taking? What doses? How many milligrams? How many units? How many times a day? Just have that list readily available. So you want to make lists. Number 2, you want to have medications at home in case you get sick and you need to stay home, of course, until you're better. So how much medication? Great question. A week or 2 is recommended to have at home. We don't want people to hoard a whole bunch of medication or a whole bunch of insulin, because then there's not going to be enough available for everyone else. So a couple of weeks should be a good amount to have at home and have on hand. The next thing you want to make sure that you have is supplies. So you want to have supplies for checking your blood sugar. You want to have, if you're an insulin pump user, you want to make sure that you've got lots of pump supplies. If you take insulin by injection, you want to make sure that you've got your needles and everything else that you need in order to do that. Make sure you've got all of your personal hygiene stuff, extra sanitizer, make sure lots of soap around as well. If you're a person with diabetes who's taking either insulin or a pill called sulfonylureas, there's a few different types of those. If you take either of those types of medication, you could get a low blood sugar. So we want to make sure that you're prepared to have treatments available at home in case you get low blood sugars. So this is sources of simple sugar like the tablets that are taken to treat a low blood sugar, or orange juice. Also, it's a really good idea to have glucagon around. So this is an emergency treatment for severe low blood sugar. It's available as an injection. More recently, it's become available as a really very user-friendly puff that's given up the nose. This isn't something that you would give yourself. This is something that a friend or family member would give to you if you were having a severe low blood sugar and were not able to take anything by mouth in order to treat that. And then finally, this is mostly for people with type 1 diabetes. You want to make sure that you've got ketone strips. In case you are ill, you need to check for ketones. That can be done either with a ketone blood testing kit or with urine testing. So make sure that you've got the ketone strips around. So those are the 5 things that are the most important to do to prepare in case you get a COVID-19 infection and you're a person with diabetes. So I've got lots more information on my website. Check it out, drsue.ca. I'll also be posting this video directly on my blog along with some other great resources for people with diabetes directly from Diabetes Canada. So I'll share those links as well. Thanks so much, everyone, and stay safe.